Awesome. Well, welcome everyone, those of you who have joined us, and there's a late welcome for those who will join us later. My name is Bianca Rogers. I am the network ambassador for Open, and thank you for being here with us. I will be presenting, I would say, and I have a co-presenter, Francis Walsh, if you could wave so the people can see you, the people, and we'll get started. So if any of you don't know what OPEN stands for, it stands for Oral Health Progress and Equity Network. And so today we're here just to kind of, you know what, let's also present, that'd be nice, right? I'll share my screen with you all. Okay. Awesome. There we go. Are we good? Can you see the slides? I'm getting head nod. Awesome. So again, welcome to our member orientation. And we stopped calling it new member orientation just because we love to see some familiar faces or some people who kind of just want to get a little bit more grounded into who we are and what we do. So thank you for being here once again. So we'll talk a little bit today about some of the targeted justice work and the equity, the oral health equity issues. Clearly that's kind of all why we're here. We will also talk a little bit about network systems and network system theory, as well as Open's approach to that in particular. We will also discuss a little bit how we were born, where we came from, how this all even started, and how you even got here. I'm sure you'll connect the dots there. And we'll talk about some of the infrastructure and the resources that we have for members, as well as other opportunities to get involved. So we want to start off on why we're here, right? This is the reason. Oral health, we believe, is a fundamental value to us as a network, and we believe that it's kind of where most of our members are rooted in when it comes to justice. Health is a justice issue. And so because of this, oral health, we know that it is vital to all overall health, Open advocates, we like to advocate for this and we mobilize it. And for those who don't have the keys and need to access good oral health. And we were very deliberate in the name. And I say we because I'm a part of the network. Oh, yes.
It looks like you may be sharing, you haven't yet advanced in your slides. So if you're moving through, we're still on the title slide and you're not yet in presenter view.
Thank you for that.
Mhm. Sorry for interrupting. You were on a roll.
No, it's okay. You all had no idea what slide I was talking about. Let's see if I go to resume share, it just stopped sharing. Okay, we'll try it again. Are we there?
Yes.
Okay. All right. Back to oral health justice being an issue. It is an integral part of who we are and why we are all here. We believe that our open members are deeply rooted in this, and it's very fundamental to our work and the work that we do. And so, of course, we included equity in our name, again, being very intentional about that, because we know that everyone should have the same opportunities to obtain a healthy life. And we know that oral health is extremely critical to our overall health. And let's see if this works for us. Awesome, it's working. As I mentioned already, equity is in our name. And so the network has done a lot of work around defining what equity means to open. And for a long period of time, since about 2016, this definition was born, and it was adopted from Healthy People 2020 and Dr. Kamara. And it's really that the network defines equity as the attainment to the highest level of health for all people. And as you see, there are some of the ways on how we can attain that. And again, shout out to the Health Equity Work Group back in 2016, because then they brought us to the Jedi statement also. And we got a little bit more deliberate and more intentional, right? Back to the justice being such a fundamental part of our network, and what we believe in. This statement was born in 2021, just last year, by the Health Equity Super NRT. NRT stands for Network Response Team, and it intensively focuses on health equity and what it means to the network. So different groups, and different work groups, different hubs of our and members of our network felt it was really important to call out justice. And so the commitment is action oriented, and it requires to be ongoing practice of critical reflection. And it's a living statement so that we can refer back to it, and it reminds us of the bigger picture of what we all do. I'll give a couple seconds to take a look at that. And don't worry, you can find this on OC. We will also share out resources, so you'll be able to read more about it. And I will now pass it over to my co-presenter, Francis, who will kind of give us a deeper dive into some data.
Cool. Thanks, Bianca. Also, just for those of you who are brand new to us, we refer to our virtual community, which is Open Communities. It's our collaborative platform. We refer to that as OC. So if anything is foreign to you today, that is where you'll be able to find most of the resources that we have. And we will get into that a bit more. But so we want to start by kind of framing a lot of what Bianca has been talking about, oral health as a social justice issue, and to show you some data that goes hand in hand with what we're talking about today. So we're starting with the two pandemics that we're facing right now, which is racism and COVID-19. So the chart here shows that across all age groups, Blacks have by far the greatest number of deaths, and that is per 100,000. So across all age groups, the disparities are stark. And we know that that's brought on by the poor social determinants of health, right? So that's been exacerbated by this nation's racist history. So while we are faced with COVID-19, we are actually seeing a lot more information now that supports folks' understanding of the system that we have is broken, and these are what the data are showing. And if you go into the next slide, please. So next slide, please. Perfect. Okay. So that was kind of at large what different racial groups are facing, but focusing now on oral health specifically, we know that there have been major improvements in oral health for the population as a whole. But there are oral health disparities that exist for many racial and ethnic groups by socioeconomic status, by gender, by age, and by geographic location. So the chart on the left that shows children aged 2 to 19, on the left is treated tooth decay, and on the right is untreated tooth decay. So you see that Blacks and Hispanics have a much larger rate than whites, in particular, whites and Asians. And then we see the same trend when we look at adults aged 20 to 64 on the right. So you see that non-Hispanic Blacks have a much larger rate of untreated tooth decay. Same is true for low-income groups and those that have less than a high school education compared to more than a high school education. Next slide, please. So in general, dental care use has increased over time for children and seniors, but not for adults. And racial disparities in dental care use are smallest for children and largest for seniors. Also, Hispanic children, adults, and seniors have seen the largest increases in dental care use over time. Next slide, please. And the cost barriers to dental care have fallen significantly for children while increasing for adults and seniors. Also, racial disparities in cost barriers to dental care have narrowed slightly for children and widened for adults and seniors. For all age groups, Hispanics and Blacks are most likely to face cost barriers to dental care, and research shows that the main barriers to dental care for children, adults, and seniors all relate to cost. Next slide, please. So this is our final slide that also shows the dentist's participation in Medicaid or CHIP. So we have 43% of the dentists within the United States are participating in Medicaid or CHIP for child dental services. The majority of those are female, the majority of those are Black, and we see a lot of younger dentists that are beginning to enroll in Medicaid and CHIP. So we know that we want to see our providers reflect the populations that they serve, and we know people are more comfortable going to providers that represent them. So we're taking a look at all the different factors that play a role in oral health equity and looking at how we can advance each of those with data to back it, with evidence-based approach to be able to change it. And so that is enough about data, and I'll turn it back over to Bianca.
Thank you. So system thinking and networks, as you know, it's in our name. So that's exactly what we are, is a network. And so systems are all around us, right? And how we operate, they set up the things and connect us through relationships. And that's really, really important to our network, as well as we can kind of see on this graphic here, kind of shows us the elements and how they're connected through the arrows. And so the relationships kind of just do this, I like to call the loop. And I think my whole life is in a loop. So it is actually all a loop, and it all works together, I think, for the greater good. And I think some of you would agree to that. So we'd look a little bit deeper into an example. This is a cool example that was shared of a mushroom and how it operates in nature and as a network. And we take a look at the threads and how they kind of spread out underground, and they connect about an estimated 90% of the land plants in mutually beneficial relationships. Again, we go back to relationships, and that's such a key word, and I want us to kind of keep that top of mind. Relationships are what's going to, and I think just in life overall, right, it is going to propel us, I think, in the right direction and help us get to where we want to. And so the health of the forest, obviously, it depends on the strength of the network here. So Open's approach to change. Based on this analogy, Open's approach, we like to work together to connect providers, advocates, educators, and a wide variety of other folks who are all interrelated within the oral health system. So in order to create lasting change, we do that by sharing information, we share resources, we convene members together. I mean, you'll hear later in our infrastructure, are so many so many is a bit of an exaggeration. There are quite a few hubs, but there's so many ways to kind of get connected and, again, obtain those resources and information. And again, as we go back to building strong, lasting relationships. And similarly, our strength depends on all the work, on all of us working in concert, right? And working one accord to have the greatest impact that we can. And I will pass it back over to Francis to give us a little bit about how we got here, how we were born.
Thank you. So what you can see here is that we are not new to the oral health game. But so just a bit of history about the oral health equity movement. The national conversation about oral health really began back in 2000, 2001 with the first ever Surgeon General report on oral health, which called oral health out as a silent epidemic. And so that really initiated a conversation that wasn't really happening prior. And then in 2007, the death of Diamante Driver, who was a young boy in Maryland, that sparked a lot of outrage across the state, and a coalition formed to improve oral health access for children in Maryland. And so that was what began as a state level systems change effort. and some movement began there. And then in 2009, the American Dental Association hosted an Access to Care Summit. Some of that movement had sparked what was then the DentaQuest Foundation, who we know now as the CareQuest Institute. They began launching a state-based funding initiative. They wanted to replicate the success of some of the initiatives that Maryland had taken on, and then began a state-level funding initiative. And that was what formed the Oral Health 2020 Network, which is what we know as Oral Health Progress and Equity Network today. So open is our brand now, and I'll talk you through what some of that means if you move into the next slide. The one just before, please. The one with the yep. There we go. Okay, so when we branded as open, we had a bit over 1,000 network members perhaps at the time, but we wanted to strengthen our commitment to oral health progress and equity. So the commitments that we agreed to was that we connect with purpose. We are intentionally engaging with partners who are committed to affecting transformation by investing time, resources, and brain power in our collective goals. We also foster safe spaces where people can feel free to express themselves openly and honestly about the complex systemic issues we're working to resolve. We disrupt with inclusion unapologetically, but we make sure to meet people where they are because we know that lasting and impactful change requires effort on all sides. And finally, we drive collective action, harnessing the collective knowledge of our content and context experts to change public perception and create unique community-driven solutions. Next slide, please. And so our design principles, as you can see some lovely network members standing here with our design principles. So we are truth seekers. We're voraciously curious, we're self-reflective and constantly engaging new perspectives to deepen our mutual understanding. We are pragmatic visionaries who are optimistic, future-focused, and inspirational yet grounded in real, tangible solutions. We are people magnets, a centralizing force that continually engages divergent perspectives to create a unified voice. And we are tenacious doers. Everything we do feels like a call to action. Equity can't wait. Lives hang in the balance. So you may see yourself in any or all of those, but that is how we describe our network and our members. So next slide, please. So this graphic shows you the network as a whole. We haven't gone too far down the rabbit hole as far as networks, network theory and systems. But so we are what is known as a multi-hub network. So there are many different hubs that have many different members. Some of them are overlapping, but so each of these hubs have a specific function, and everything that we do is centered around the open blueprint for structural improvement. So you'll see at the very bottom, it says NOCT there. We have many, many acronyms in this network. So the NOCT is the National Oral Health Connection Team. And so they are the network leadership and support hub. So they are kind of what helps all of the rest of these hub teams function. They are intended to have their ear to the ground for all things that network members are up to and make the network, a greater value for all members at large, but then also making sure that we're all focused and staying on track. So that is the NOCT. If you follow around to the left, you'll see the ROCT. Which is very similar. It is the Regional Oral Health Connection Team. So we have state and grassroots representatives in all 50 states plus DC. There are still some vacancies, so we're not fully, but we have representatives in at least all 50 states. And so those representatives are facilitated by 3 regional leads. So we have our nation broken into 4 regions. And then having a state and a grassroots representative allows us to make those state and local connections and make sure that we are reaching alignment. And so state reps both bring what opens up to back to their states, and grassroots reps to wherever they're at locally to share out, promote, and then also make sure that the voice of the folks that they represent is carried back to the network. On the right-hand side, you'll see NRT leads. That is the network response teams. Each team has at least one lead, and those are some issue-based teams that form around a specific topic. So that may be rural oral health, or that may be persons with disabilities, that may be folks focusing on data and measurement. But so these issue-based response teams form, develop a strategy, and share out what they are up to with the rest of the network. And then finally, the lever leads, we have the open blueprint for structural improvement. And now we have a hub that is specifically designed to finalize our collective action strategy, which we will move into I believe actually we'll move into the next slide. But so all of that to say, each of these different teams, they come together and they work as a solid unit. There are many people involved that are working lockstep and carrying out the mission of this network, which is to advance oral health equity for all. And so there's many, many ways to get involved. And so this is kind of the highest level snapshot of all the different parts of the network. But if you move into the next slide, please. So I can explain what this open blueprint is. That is what all of the rest of our work is now centered on. But over the past several years, beginning in 2020, network members have been working collectively towards achieving equitable oral health. And we began by embarking on a process to identify new goals and strategies using an iterative systems mapping process. So Bianca told you a bit about how we use systems thinking. So we took on a whole process that led to the open blueprint for structural improvement. So we identified, initially looking at a map of the existing oral health system, we were able to identify 5 areas of leverage that are ripe for impact. And so that began with amplifying consumer voices, advancing oral health policy, integrating dental and medical, emphasizing prevention, and bringing care to the people. So those are our 5 levers. We also have strategic interventions for each lever and a set of action steps at a local, state, and national level that we now have these lever leads that are moving that into a collective action strategy. So this open blueprint, this is how we organize our work. You can think of it as kind of like the umbrella of our work. Everything we do will fall under that. It will be our collective action strategy for years to come. So do make sure that you get to know it. This is on our website. This is all over the place. So we'll make sure that as much information as you want on it, you can get super involved, but definitely stay tuned. And next slide, please. So I'll turn it back to Bianca.
How do you connect with us, right? So we luckily have quite a few ways to get involved. And so we have, as we mentioned, we call it OC, which is Open Communities, and I will share, I'll share my screen again and take you all down that path in a little bit. We have Creating Connections, which is a bi-weekly newsletter that goes out. So be on the lookout for that. It has a lot of information, upcoming events, things that need to be shared network wide. Monthly federal policy update calls. We have a Take 20, 30 within the network. And what that is a way for you to kind of share your knowledge, share what you know, and share with the rest of the network. So it can be 20 minutes, 30 minutes, 60 minutes. There is a form that you can fill out and we will help you get that scheduled. That's all you have to do is just fill out the form and we take care of the rest and you get to present. And people get to show up and learn from you. And so again, back to building relationships and resources, that is one of the ways that we are able to spread that out. And so, of course, as we mentioned, as you saw the infrastructure, there are network response teams, what we call them NRTs, and learning collaboratives. And so these are areas of, they are specific interests. We have quite a few, to name some of them, are data, health equity, data measurement. That's what it is. We have LGBTQ+A, we have policy. There's quite a few more that I'm sure I'm missing, but those are other areas. And if you have something that you're interested in or a specific area of interest and we don't have it, it can happen. You can build it, you can create it, and people will join. And we also have open meetings and events. And so, as we mentioned, we hold convenings. This year, we'll have potentially one in person, if COVID and all the restrictions allow, as well as there will be other ways of events that we'll do virtually to continue to connect with network members. And if you haven't been to our website, please go to it. And here's a little bit about the online platform that we use. It's, again, a way to connect. I will show you all how to navigate it just a little bit, high level tutorial. And it's just definitely a way, again, to share resources and stay connected. So let me take you all to there. I almost lost you. So as you see here on my screen, I have gone in, I logged in, and this is the first page that it takes you to, the landing page. So you can take you right into communities, but I won't do that just yet. I want to show you that there are ways to have community discussions. So anything that you're looking for, anything you'd like to share, feel free. It can go right on this, you can post right here. You'll see it on the left-hand side, as well as on the right-hand side here, you'll see our events and our upcoming events. And you can typically click on them and find ways to register if there's a registration required, or finding ways to add it to your calendar as well. And as we mentioned, the lovely blueprint, it is our map. And so that is, you can learn more about it and more in depth by watching the video. And yeah, I will take you now to communities. So if you click on Take Me to Communities, we have a lot of different communities, right? So one of them is open wide. This is for every single person that is a part of this network. We are all welcome to be a part. You are automatically already a part of it. And again, you can post things, you can see who are the members of it all. You can upload events and files, as well as one of the ways is to join the group. And usually if you're not a part of that community, it'll show you right here. A way to kind of stay up to date. So let's say you're not one to come to the site all the time. Maybe you just would rather get kind of notifications. You can get notifications on every post, just on a summary of daily digest of what's happened, or weekly, or limited. And so I will take us to another community. So we have them broken down by the hubs that Francis shared before. So we have the network response teams. And so if we go, let's see, I'm trying to see if there's one of them I'm not a part of. So you just click here on Ask to Join, and the owner of that, which is typically our staff, they will let you right in. So I'll click that. And awesome, then your membership is requested, and then you can find the community. As other ways to kind of, again, building relationships, finding people, maybe you met someone through a call of some sort, you have their first and last name, you can enter it here. There are some other ways to find them through the job titles, organization names, email, and you can kind of find a way, this is the way where you can find them and connect with them. As I mentioned, events. And there you have it. And we're currently right now in the member orientation. So, and if you have any questions ever, you can feel free to reach out to our staff. We will be more than willing to, I myself would be willing to walk you through, do a one-on-one into the platform as well. And this is the backbone, the staff, and these are frequent faces you'll see and you'll probably interact with. Who's Ife, who's the executive director. myself, you have Frances, who you've also seen in this call. Valerie, she's the main person, honestly, behind it all. She's our wonderful admin, and in charge of our admin and executive assistant. We have Bianca Rogers. So yes, note there are 2 Biancas on the team. That doesn't always happen. The luck of the draw that happened for us. And we have Stacy, who also does a little bit more of the capacity building. So we're just here trying to save the world with you all. And I want to open it up if there are any questions. I'm going to stop sharing my slides so I can see everyone's faces. Are there any questions that are coming up for anyone? I'll see the chat. I'm sorry.
Hey, Bianca, it's Laura. I don't really have a question, more so than a comment, and I'm not sure. I do see some names on here that I don't recognize, so hopefully they're new people. But I would encourage everyone to get to the communities, because honestly, that's been my biggest, I don't know what the right word is, connection, I guess, is having those communities available. And I would just encourage everybody, if you're not in these communities, to go to them, because they're amazing. And the network response team, I participate in the rural health one, and I mean, the information is invaluable. So if I could say anything, that's what I would say. The whole organization is amazing, but the communities really, really are awesome.
I paid her to say that. I'm kidding. Thank you so much for that. Thank you. So there aren't too many of us on the call, and we have time. I want to do quick introductions. So if you can tell me your name, where you're located, and your level of involvement. So maybe if it's been, a year, are you just brand new, several years, are you seasoned, as we like to say? Let us know your level of involvement, and maybe if there's some areas that that you're currently either you're interested in or that you are a part. So I'm going to just call on someone, if that's okay, and then we'll popcorn, and then you just pick on someone else. I know sometimes it's kind of hard to see names, but I will start with, yeah, it is really hard actually to see names, but let's start with Donna.
Hi, everyone. I'm Donna. I am the West Virginia state rep starting this session. I've been the grassroots rep for the past 2 years, but sadly I came on right as COVID started. So I have yet to be in any in-person meeting with everyone. So I look forward to doing that in the future.
And Donna, feel free.
Should I pick Grace?
Hi, everybody. I'm highly seasoned, or I have special seasoning, perhaps. I've been part of the network for a while, early on as a grantee. I'm here in Colorado and currently support the network's communication. So excited to be here and see all these faces and hear your feedback and get more information about how we can communicate even more and better. And I will popcorn it to Celeste. Oh, maybe she's not able. So how about, how about Brittany?
Hello, I'm from East Tennessee, and I joined as a grassroots member, so I'm brand new. And I guess I will send it to, it's hard to see names, Teresa.
Hi, I'm Teresa Ramirez from Denver, Colorado. I'm actually the dental hygienist for the Denver Public Schools District. I have attended many open CEs and so forth. And hopefully I'll be able to get a little bit more involved over time. But I really enjoy what Open presents, and I'm actually trying to change my email address and password and it won't let me. So I will leave it at that.
I think names aren't showing up, so Bianca, maybe
Yeah,
just calling folks.
there was a toss to Elliot in the chat. There was a toss from Celeste to Elliot, so we'll rock
Right,
with
I'll
it.
take it.
We'll go with that one.
Hey everybody, I'm Elliot. I am new to Open and the new state rep for Virginia. I'm in Richmond. And I recently joined the LGBTQIA+ NRT, so I'm looking forward to getting involved with folks in that group and learning more about Open. And I've been on a few calls, the regional calls, which have been really nice, getting to know people. So excited to be here.
Awesome. Thank you for being here.
Thanks. Do you want me to toss it to someone, or do you
If
want to
you
call?
can, yeah, feel free.
I will toss it to, how about Christian?
Hello, thank you, Elliot. I appreciate it. My name is Christian Mulway Anderson, and during my day job, I serve as an executive director for a nonprofit organization. We fund orthodontic treatment for kids in Oregon and Western Idaho, since the Oregon Health Plan doesn't cover that yet, but we have gotten that changed upcoming. But for Open, I have spent the last year being a grassroots rep. And this year I'm taking on the state rep so that Laura Mckean, who was the state rep, can take on the regional leadership. And then in addition to that, I've joined Lever Lead's team for the group called Emphasize Prevention. And so I'm very excited about that. I think that we have a lot of awesome work ahead of us. So that's my background. And I will go to Rhoda Gonzalez.
I need to come off mute. Sorry, I am CM Patients today. My name is Rhoda Gonzalez. I'm a dental hygienist in alternative practice in California, and I am government relations chair to California Dental Hygiene Association. And I'm also working with the local oral health programs and the school-based sealant programs. And I'm happy to be here.
Thank you, Rhoda. What about Katie?
Hi everyone, my name is Katie Glugert and I'm the Oral Health Program Coordinator for Montana DPHHS, and I am the state representative for Montana. And we have Emerson joining us today.
Awesome. It's like take your kid to work day all the time with these Zoom world, being working from home.
Has Tony gone yet? I don't think we've heard from Tony. Okay.
Well, good afternoon, everyone. I'm Tony Russell. I'm CEO of Detroit Community Solutions, and really happy to be a part of your National Oral Health Connection team, a hard-working group of people. It's a center holder in the network, and also a part of the Encompass Solutions Board, and just excited to meet new people and to see you all, getting involved more and more in this incredible network. And so I will pass to Jennifer.
Thank you, Tony. My name is Jennifer Avery. I have served with Open, I guess since last year was my first year. This is a new year. So I am the state representative for Arkansas. For my day job, I work for Special Olympics Arkansas. I'm the health coordinator. So I coordinate all of the health programming across our state for our athletes with intellectual disabilities. And I am the chair of the Arkansas Oral Health Coalition and the legislative chair for the Arkansas Dental Hygiene Association. So Bianca, I know I've already sent you an email about something else, but I also know that I want to join one of the NRTs, but I can't pick. There's too many good things.
Well, you
I
can
will
be
say,
part of multiple NRTs. That's not a problem.
right. So, but I know this is a really big year for Arkansas. We have so much happening right now. We have some like Medicaid waivers that are coming due for renewal. And there's so much that I need to know. So don't be surprised if you guys see me in open communities begging for your knowledge. So, but that's pretty much me. And I'm gonna toss it to, is there anyone else left actually? Or am I
There
the last?
is, but I am maybe, yeah. I think you're on as a guest, maybe, as I'm looking through the names, but yeah, feel free to share.
Yes.
She waved her.
Yeah,
She
it
waved
just
her
says
hand.
guest.
Yeah.
Hi, this is Jo Jaskell, and I'm happy to be here. I've been around in oral health. I'm a dental hygienist by trade, way back then, and I've been in public health in California for numerous years with school-based programs and advocacy statewide, and have quote unquote retired a year ago, but feel the need to be involved again. 1 year has been enough to be off, and kind of around since Open started. And again, I'm just thrilled to see how everything has evolved and hoping to get more and more involved. I now live in Tennessee, in Nashville, so down in the Southeast for a change. So, well, I'm welcoming myself into the group and can't wait to meet you.
Absolutely welcome. And Laura, I know that you gave us a lot of praises, but if you wanted to go, I formally do the introduction.
Sure. My name is Laura Mckean, and I am the Director of Oral Health Services for All Care CCO. And we are charged, there's 15 CCOs in Oregon. We're charged with managing the care for our members, our Medicaid members, physical, behavioral, oral, and transportation. And I've been involved in Open for about 3 years now. I was grassroots and then state rep, which Christian is taking this year. One of the things I'm looking forward to this year is being involved in the lever lead position as Amplified Consumer Voices. And I shared this in our meeting last hour, but I have I'm not afraid to speak up for oral health. People in the state know that, Christian knows that. So with this lever lead position, I'm looking forward to empowering consumers to amplify their voices, and because consumers need to be heard. They need to be heard about what their needs are for oral health and what they would like to see, and the benefits that people need for dental. We championed pretty hard last year for Medicare dental benefits, and I don't think it made it into the Build Back Better package, but this organization, the advocacy that they do, I'm throwing a little more praise in there because the advocacy that this organization does for people is wonderful. And we had a really hard task in front of us for Medicare dental benefits, and worked really hard. And doesn't mean we're going to stop that hard, because we'll get them there eventually. So that's me, and I'm in Oregon. I think I said that. So Christian is my partner in crime, and we're looking forward to this year.
Just to remind you, it's the work that you all do, okay? You all do the real heavy duty lifting work here. So it's you all who do this work. So I'm going to pick on some of my seasoned, maybe members, and I want to know if you have any word of advice for our newest members, and maybe for our members who've just been involved for maybe just a year. So maybe someone like Tony, potentially, who could kind of share a little bit more about what would be a piece of advice, and anyone's open, of course, to share any advice that you have. Laura, you have led the charge with kind of sharing your what you have found of interest, as well as beneficial, excuse me. So Tony, would you share, maybe kind of give some words of advice as a former leader, as a seasoned network member?
Sure. Do you want me to just go through it as we practiced, or you want me to share? No, just I think that this is one of the most amazing groups of people on planet Earth. And it's easy to get involved. And it's like a network. Everyone is supportive of everyone. And it's just amazing. So my advice would be jump in, get involved. You know, everybody's reachable, approachable. It's a unique thing. It's open. So yeah, that would be my advice. You know, again, the support is amazing. When I first came to like my first convening, it was just amazing because I was new, but I wasn't made to feel new. I wasn't made to feel like an outsider. Every voice is important and open. And we need your voice because the work is yet before us and it's a lot to, you know. So yeah, that's my advice. Get involved. Just jump right in. And so how was that, Bianca? Is that okay? Did I forget
Exactly what I
anything
paid
that
you
was on
for.
my
No
script?
worries. Exactly what I paid you for. Thank you,
Okay.
Tony. We appreciate you. Anyone else? Anyone else has any word of advice? Any suggestions? Yep. Thank you, Christian. Go ahead.
Yeah, so I'm not a wise person, because I've only been with the organization for a year. But one of the things that I eventually had to do was step away from from trying to understand the structure of open. As a new person, it was incredibly complicated to understand how everything was tied together and who did what. And so I would just say, but this could just be my own personal experience. I would just say, don't think too much about the structure of the organization. And like Tony said earlier, there's just no wrong door to talk to somebody, and they'll guide you in the right direction. But I guess I would just say, don't worry too much about understanding the structure at first.
Thank you.
Just as a follow-up, did you find the graphic today to be more helpful for the we're evolving? I don't know if you've noticed.
Yeah, it was more simplified, which makes it much easier to grasp.
We're getting there. So
Yeah.
any feedback is wonderful feedback because we're gonna keep trying to make it easier.
Awesome. Anyone else? Are there any questions that we could answer? Francis has dropped it now, I believe twice in the chat. Be sure to please take and complete the meeting evaluation. Okay, I see a lot of black screens right now, so I'm assuming there's nothing else to say.
I think I also just want to jump in because we do have a lot of seasoned members on the call today, but we have a few newer folks, and I think it's just, I mean, it speaks to the engagement of all different types of network members, and there are no wrong doors, there are only open doors. So as you can see, there are a lot of people that are here that would be willing to help out, you know, whatever you're looking for, anything that you want to get involved in. And so any questions that you may have following this presentation, just please keep coming back. And you can always find us on Open Communities, go into that directory, and just reach out there, right? Like, you know, you can always pick anybody's brain. You can always throw up any kind of question, any kind of announcement. And Grace has just thrown in our social media handle. So follow us, we'll follow you right back. And Bianca has dropped in her email address. So just stay in touch with us. And we look forward to seeing you all very soon.
We'll see you all around. Thank you. Have a great day.
Thank you.